Dr. Ryves Moore is an orthopedic surgeon with Specialty Orthopedic Group in Oxford, and he joins us right now. He also happens to be a guy who did his fellowship, extended training under Dr. James Andrews. And so it seems like it makes a whole lot of sense to talk with Dr. Moore about UCL injuries and Tommy John surgery. Doc, thanks as always for your time. Great to be with you again.
Yeah, thanks, Richard, for having me on.
Is this more common than it has ever been? I mean, Tommy John surgery wasn't a thing, and then it became a thing, and now it's something that we just hear about all the time, especially with baseball players. Is this procedure and is the UCL injury more common than it used to be?
I certainly think it is becoming more common, and is that because there are more injuries out there, or are we getting better at determining if a player is injured? There are certainly a lot of studies out there that show that there is a significant increase in UCL injuries in the age group between 15 and 19. Well, those are obviously your high school kids, early college pitchers. So I do think there is an increase in that, whether that's attributed to year-round baseball, or is that attributed to our medical expertise in terms of better diagnosing the injury? And it's probably both, to be honest with you. But I do think it is becoming more common, and I do think there are things, there are reasons why that's happening. And it's certainly becoming an issue in terms of the age of throwing athletes that I see in my office every day with elbow pain and Tommy John injuries. So I do agree that it is becoming an issue, and it is becoming more prevalent, unfortunately.
There's a lot to unpack there, but before we do that, kind of walk us through physiologically what's going on. So, I mean, obviously we're talking about Gunnar Hoglund, who is about to have Tommy John surgery. He's going to Dr. Andrews next Tuesday to have that partially torn UCL repaired. So when we hear UCL injury, torn UCL, partially torn UCL, what are we talking about?
Yeah, so the ulnar collateral ligament to UCL, it's the ligament on the inside part of the elbow that is the main restraint or backstop against the stress that your elbow sees when you perform an overhead activity. And that could be not only throwing a baseball, it could be hitting a volleyball, doing a tennis serve, throwing a football to a certain degree. It's a little bit different biomechanics in terms of how you throw a football versus a baseball. But obviously the sport that gets the most notoriety for UCL injuries is baseball. But it certainly is stress. The ligament is stressed in other overhead throwing type of sports. And so what happens is that the UCL sees an extreme amount of stress with that motion. And it's not a normal physiologic motion. And so our bodies were not made to throw objects overhead. And so what can happen over time is, especially if the mechanics of how a person throws are not good mechanics, if you have a tight shoulder, that can lead to the thrower leading with the elbow, which puts more increased stress on the elbow, the inside part of the elbow, and specifically the Tommy John ligament. And over time, that can cause stretching of the ligament to where it becomes loose. It has some laxity. You may not have a tear in it, but it can certainly become incompetent. Or if you have a traumatic injury where you throw really hard and you feel a pop, is kind of the classic history you get with some of these players. And you can have a full thickness tear. Or you hear in the kind of the older guys, such as the more experienced college players or the pro guys, that, man, I've just got some elbow tightness and soreness, it just doesn't feel right, and you get an MRI scan and they've got a UCL tear. And so kind of what leads to that is overthrowing, not abiding by pitch counts, the good resource is Pitch Count USA, which is a website that actually has guidelines on there about perfect pitch counts for certain ages, and if you throw a certain amount how many days of rest you need. So, yeah, there are reasons why it happens, and there are certainly various types of tears, from your partial tears that you've suggested, as well as the full thickness traumatic type tears, as well as your kind of chronic attritional tears. So those are kind of the options out there in terms of what types of injuries there may be.
All right, so tell me I'm dumb for asking this question, and I will not take any offense. Visiting with Dr. Ryves Moore from Specialty Orthopedic Group. He's an orthopedic surgeon in Oxford. This feels like it comes from like a Facebook conspiracy theory post, but there would be some out there that go, well, guys are not throwing enough anymore. If you look at the old Major League Baseball pitchers, they threw every 4 days, and they would always throw 120 pitches. And when you looked at their stats at the end of the year, they'd have, 24, 27 complete games. It didn't used to be this way. So it kind of goes back to what I was asking earlier. Is there any science at all that supports the idea that throwing more is actually better, even though you're kind of telling us that it's actually quite the opposite?
Well, so there's different animals there. So there's a difference between what I would call a mature thrower. So your major league guys, their bodies are developed, their arms are developed, their shoulders are developed, as opposed to a high school kid. He is not done growing. Your clavicles continue to broaden until you're about 22 years old, and so the stress that a high school pitcher or overhead thrower can withstand is much less and needs to be less frequent than somebody that's 27, 28, 29 years old can withstand. There's a reason that the average Major League Baseball pitcher, their age is about 27 or 28 years old, and that the Major League season is 162 games. And if you look down the line, starting at AAA, AA, and on down the line to college and high school and those schedules, they steadily decline in the number of games. And so there's a reason for that, because pitchers in high school can't undertake the same workloads and the amount of stress and the frequency that they see that stress year round. And so because
does that lead to the concern that you were talking about a second ago with youth baseball, where you got kids in the summer at age 10 that are playing 70 games?
Certainly, and especially the ones that are pitching a lot. And kind of the common scenario in youth baseball is that not every team's going to have a stacked bullpen and 3 or 4 starting pitchers that they can run out there every time and compete. And so what happens typically is you got 1 or 2 kind of aces on these youth baseball teams, and they get pitched a lot. And so there is a concern and a possibility of overuse in those scenarios. And we recommend, about 3 months of rest in a calendar year. So if you play spring ball and summer ball and fall ball, do you take 6 weeks off in between? I think you do, because, like we alluded to earlier, these young developing arms can't take the stress that a major league pitcher, like I said, they're just 2 different animals, and they just can't take the stress that somebody that has a developed arm and has access to, Major League Baseball athletic trainers and physical therapy and arm care. It's just not the same.
Ryves, let me ask you one more thing before we run out of time. Only about a minute left. We were talking earlier with Jay Powell, former pitcher at Mississippi State, pitched in the big leagues with the Marlins, won a World Series, and he says that, guys are chasing the radar gun right now. Everybody's throwing harder. We look at college staffs, and you got, half a dozen guys that are throwing 94, north of that. Some staffs have more than that. Is there something to the idea of all of these kids pitching at showcases where they're getting college scholarship offers and exposure to scouts based on whether the first number on the radar gun is a 9 when they're 16 years old that is leading to the proliferation of UCL injuries and Tommy John surgery?
I do think that the radar gun, while it is a good tool to have to figure out how you're progressing in your arm care program, how you're progressing as a pitcher in general, I do think that there's a good way to use it, but there's also kind of an unintended consequence of that, and that's for these guys that are doing these showcases that are 15, 16, 17 years old. They try to throw harder and harder and at max effort more more consistently, which I think does put more stress across the elbow and the UCL ligament.
Prognosis for a full return for Gunnar Hoglund? I mean, the success of Tommy John seems to be getting better and better. Only 15 seconds left.
Yeah, I mean, it's a 94 to 95% return to play within about 10 to 12 months in kind of your younger athletes, and then probably in the pro guys, which I would imagine he'd be going pro, is maybe out to 18 months. But I would anticipate a full recovery, no issues.
Dr. Ryves Moore from Specialty Orthopedic Group, orthopedic surgeon in Oxford. Thanks so much, Ryves.
Yeah, thanks.